So some variations you're gonna see, like when they come in on the ambulance, a lot of times they won't use the pigtail. You just want to toss me one of the catheters, just the catheter. Thanks. A lot of times, like when they come in the ambulance or in the emergency room, what they'll do is, instead of having the pigtail, they will just put one of these on. This is the same port as the pigtail. So they'll put in their IV, and then they'll connect this way. And then they'll just tape it down. And on this one, you don't have to prime it with saline, because a lot of times what they'll do is they'll hook this up directly and they'll draw labs off of it from like the emergency room. And then when they're done, they take this off, it's primed with blood, and then you can just flush it. So like a lot of the patients, right when they come to the emergency room, they won't have a pigtail. Then you have the option of either leaving it alone, it's fine the way it is. You can add a pigtail to the end of it, or you can take the dressing off, put a pigtail on the hub, and then put it back together. Usually my rule of thumb is the less you mess with it, the better. But if you need, if it's like in the AC and you have to continually hook up and unhook fluid and it's like taped down real tight, sometimes it's nice just to have that little bit of pigtail so you're not...
You pinch the person a lot
Yeah.
when you're trying to screw it on.
Pushing it around too much. So you're gonna see that. You can draw, when you place an IV, you can draw labs from it. And in some hospitals, you can draw labs after the IV's been in a while. Some hospitals will say you can draw labs only when you place it. And then some, depending on the policy, like the day, you know, if patient has troponins that are due every 6 hours, sometimes you can draw labs from the IV.
What's TMC's policy? Do you know?
I think it's just when it's placed. But what you have to do is, if you're gonna draw labs from the IV, you've got saline in the tubing. So what you have to do is what they call waste. So you pull back, with the peripheral IV, you'll pull back 5 mLs, you'll flush it, pull back 5 mLs of blood, and then that gets wasted, that gets thrown in the sharps. And at that point, you can hook on this device and pull your labs. That way you're getting pure blood. Otherwise, what will happen is everything will come back diluted. You'll get like a CBC with like a hemoglobin of 4, a potassium of like 2, and then most of the time they figure it out. Sometimes they don't, or they're not sure, and they can cause some like pretty big problems for care based on, you know, bad lab results. The 2 glass vials, these are blood culture vials. The reason they're in glass is because plastic grows bacteria a little bit differently than glass. It's got medium in the bottom. The other version you're going to see of these are what we call wine bottles, and there'll be a gram-negative bottle and a gram-positive bottle, and usually lab draws those. But sometimes in the ED or a nurse, you'll draw the glass vials. When you do these, you got to make sure the tops are really clean with alcohol or chlorhexidine, because you don't want to have any bacteria get pushed in when you hook this up. The other thing is you'll do 2 vials from 2 different sites, and sometimes if they're only able to get 1, that's okay, but you always need 2 vials, because one's going to be gram negative, one's going to be gram positive from that site. And you have to label where it was drawn from. So if you did, you know, forearm, you'd put left forearm on both vials, and you'd have a label for each vial, you know, a label, and then there'll be another order for the second blood cultures, and you have to draw from a different site. You could draw from a newly placed IV, you can draw from a newly accessed port, newly placed lines usually. If a patient has like an old IV, a lot of times lab will just come up and they'll draw one off this arm and one off this arm. But that way they have, if one set grows a little bit of bacteria and the other set grows absolutely no bacteria, then they can think that maybe it's a bad sample. But if both sets grow the same, that's why they'll draw two. And then you got gram negative and gram positive, so they can tailor bacteria to whatever they think is growing. And if a patient has an infection, usually what they'll do is blood cultures, chest X-ray, UTI, the urine sample. And those will be like the three things that right off the bat they do automatically, like when somebody comes in the ED with like a fever or some kind of infection. That way they can get those three things ruled out as quickly as possible and get antibiotics tailored to them. Let's see, do you want to toss me a tourniquet?
Yes. I'm gonna toss this one.
Okay.
Mm.
Alright.
That's graceful.
Another thing, can I borrow your arm? Okay. So a couple other things about pinning down a vein. Oops. Is go ahead and flip your arm over. So like right here's a good one. A couple things you can do is, we talked about pinning it down with your finger. Another thing you can do is hold it like this and pull the skin tight. That'll keep the vein from sliding. Sometimes especially when you're starting, you could have your CNA or somebody else hold the arm tight. On a hand, you can pull it tight like that. You can have them make a fist. Has anybody seen them draw blood or put catheters or draw blood on babies? They'll bend their hands like almost like against their arm to get the vein to pop up. So don't be afraid to kind of manipulate skin and stuff to get that vein to pop up or to pin it down. And the more you do it, the more tricks you'll see. You'll see other nurses do things, but always be kind of watching how other people do stuff, because you'll be like, wow, that's cool. Like, I'm gonna start doing that, or trying it that way. Let's see, James, you want to dress this IV for me? You're gonna find that usually the hospital have a couple different dressing types, and you'll have ones that you like more than others for different reasons. This is my favorite one. I like this one better than this one, and you'll see just the way they wear on a patient over a couple days. But the other thing is you'll have different types of tubing. If a patient's going to surgery, you want that thick tubing that you guys have, because you can put more fluid through it. This tubing is a little bit thinner, but I think it's still bigger than a 20 gauge catheter. So in your system, the smallest size dictates what your drip system, what your capacity to bolus fluid is. So even though this is smaller, it's still fine because your catheter is going to be smaller than this tubing. But usually what I'll do is, the reason I had all those tubings, that fat tubings, is because our kit at work comes with those, and you can get these separate. So what I do is I toss these dressings, or I save these dressings for you guys, and I save those tubings for you guys, and then I get this dressing and I get this tubing. The nice thing is the patient, this is way lighter, it's not flopping around, it's less likely to pull out, and these dressings just stick better. I don't know why, I just like them. So I'm gonna let you tape this on, and I'll show you another little trick. Is there a roll of tape over there?
Nope.
We have a few, there's a few over here.
Okay.